Next to the conflict in Yemen, where over 10,000 children have been killed or injured since the war broke out nearly 7 years ago. There is a lack of basic medical facilities and life-saving surgeries for those that desperately need them.
This is 5-year-old Amina Nasser, hugging her toys in a cancer ward in Yemen. Amina's life is in the hands of a collapsing healthcare system, one that has been eroded by Yemen's 7-year-long war. Amina lives in the middle of rudimentary equipment, peeling paint, and the stench of urine. She gets free chemotherapy, but her parents are struggling to afford medicines and other tests.
The patients who come to Al Jamouria Hospital are poor and live in the suburbs, where the simple medical supplies are non-existent at the hospital, such as bandages, sterilized tools and medicines like antibiotics. So patients end up spending a lot of money to provide these supplies. There is a severe shortage in medical supplies here.
Like Amina, millions of Yemenis are struggling to receive life-saving treatment. Some don't even receive proper care in time. Like 16-year-old Zamzam Hizam. She was waiting for a sponsor to pay for her heart surgery when gangrene caused by the untreated ailment ate away at her foot.
She suffers from a congenital defect, which led to the failure of the patient ductus arteriosus to close. In addition to that, she has severe inflammation of the valve, which ruptured one of the valve ligaments. Therefore, the valve is now severely infected.
In room 11 of the same hospital, Hassan Mohsen Al-Raisi is sitting on his mother's lap. The 1-year-old has a hole in his heart, and his parents are desperate. They need to travel abroad for surgery, but the blockade means that they are left without any options.
The doctors who did the echocardiography check for him and noticed a hole in the heart and said he needed a surgery abroad. We could not travel because of the blockade. A siege by land, sea and air. How can we travel? In addition to the financial cost. The cost is very high.
The war in Yemen has destroyed its health system, hindered the entry of foreign surgeons and restricted travel abroad. Only half of Yemen's medical facilities are fully functional. Public hospitals lack basic equipment as well as staff. Doctors and nurses prefer to work at private clinics or international organizations.
We are suffering from low and delayed salaries, and they blame the lack of financial consolidation, but this was not the case before.
This is a war that the world has forgotten. Millions are starving, poverty is rising, and a child is dying every 10 minutes. Yemen is the world's biggest humanitarian crisis, and it seems to be going from bad to worse. With medicines and aid dwindling, Yemen now risks losing an entire generation of children. West Asia Bureau, WION World is One.